My name's Dr. Laura Shim, and I work in a practice in Joliet, Illinois. I'm originally from Oregon. Honestly, I couldn't have asked for a better first year or first office, to be honest. I work in a multi-doctor practice, so one of my main priorities was to be able to partner with other doctors who had more experience. And I remember coming to Dr. Leeds last year, and I was terrified and anxious and all those things, and I knew I was lacking in some clinical skill levels and leadership skill levels, and when I came to Dr. Leeds, there was information overload, basically. But in the past year, everyone at my office has been really great. Everything, or almost everything clinically that I was afraid of, I'm now pretty comfortable doing day to day. There are things here and there with leadership or clinical or otherwise that I still work on, but I honestly couldn't have asked for anything better. So I think Heartland Dental has benefited me the most, probably through the classes that they offer us. Before signing with Heartland Dental, I interviewed at a lot of practices. I would probably say 10 to 15. And like I said, my priority was just learning as much as I could. Coming out of school, I knew I needed to learn a lot still. So that was my priority. And I think if you're proactive about wanting to learn more and wanting to better your clinical skills and leadership skills, all the resources are available as long as you take it. So I've been very lucky that my office has been able to accommodate me going to classes and things like that, and I've learned so much in the past year. The endo class, for sure, that Dr. Bruder lectured on. Endo was my most weak subject in school, and I was terrified of molar endo. Even going to work every day, I was like, oh man, if today I have a molar endo, I don't know what I'm gonna do. But honestly, that course helped me a lot. And we did endo a little bit differently in school. And so just going through the steps one at a time at the class was very helpful and useful. And like I said, now molar endo is no big deal. So that was a big takeaway. The one thing that I would tell new doctors if they're considering joining Heartland Dental would probably be do it. I think every practice is different and every office within Heartland Dental is different. With that being said, maybe go shadow and maybe go see how the office works and how the flow is. In general, I think that there are a lot of great systems in place with Heartland Dental, and so as long as the office is a good fit with you, I think it's a great structure to be able to learn a lot of different things right when you're fresh out of school.